And as we know in America, when there is a crisis, women and people of color are hit the hardest. And the care crisis that has exploded in the pandemic is no different. Between February 2021 and the start of the pandemic in February 2020, women lost 5.1 million jobs, with women of color suffering the greatest losses, and 2.3 million women leaving the labor force entirely, in large part due to caregiving demands. Lost wages due to the lack of paid family and medical leave cost families an estimated $22.5 billion each year. For Black, Asian, and Hispanic families, the percent of household income lost due to unpaid leave is even greater. We now know more than ever before why paid leave is crucial, but today's panelists will help us understand the role of racial equity in paid leave policy and what it looks like to make a comprehensive paid leave policy a reality in the United States. First, I will now go ahead and introduce all of our panelists. First, we have Kristen Smith, Associate Professor of Sociology at Dartmouth College. She will take us through her research entitled COVID-19 and Paid Leave, Racial and Ethnic Disparities. We will then turn it over to Cassandra Gomez, staff attorney at A Better Balance, who will walk us through what the state and what the landscape of state and of state paid leave policy and on the federal level as well, and what an impactful policy actually looks like. Then Alyssa Silverman, DC Council member, will focus on the path to achieving paid leave on the local level legislatively, including some major victories this week. Carol Joyner, Director of the Labor Project for Working Families in partnership with Family Values at Work, will then help us connect all of the pieces of paid leave policy, research to the fight for a federal policy. After each panelist presents, we will then go into a larger roundtable discussion followed by Q&A. I will now turn it over to Kristen Smith.
Great, thank you. I'm so happy to be here. Thank you so much, Raven, for moderating this group. And today I am talking about COVID-19 and paid leave and the FFCRA. I am working on a project with Elena Patel and Tanya Biker, and this is research that is funded through Washington Center for Equitable Growth. So first, I want to just highlight and underline some of the things that have been mentioned earlier today in the opening session, that COVID-19 has really shone a spotlight on the existing racial and ethnic and gender inequalities in our country. Now nearly 2 years into the pandemic, we've seen wave after wave of surging cases and how this has really strained families. The importance of access to paid leave has become paramount. You'd have to be living under a rock to not see how important paid leave has become to families in their quest to balance work and family. Those that don't have access to paid leave have really been forced to choose between providing and earning a paycheck. We've heard how women have responded to these difficulties by leaving the labor force. In September 2020, there was a mass exodus of 800,000 women who left the labor force, but really women have been leaving the labor force every month of this pandemic. African-American and Hispanic workers, particularly women, have experienced the highest levels of unemployment in April 2020, and their recovery has been slower, as this slide from data from the BLS shows. So we can really see clearly how Hispanic women in particular went from about 4% unemployment prior to the pandemic, shot up to 20%. That's the tallest blue line there on the figure. And you can see also in this graph how minorities have recovered much more slowly than, for example, the red line, which is white men who had an uptick, but then recovered much more quickly. So I want to talk a little bit about the FFCRA. The federal government acted swiftly in response to this pandemic. The FFCRA was signed into law on March 18th, 2020, with paid leave to begin on April 1st. So when Congress wants to do something, they can do it, right? I mean, that's what this clearly shows. So what is in the Families First Coronavirus Response Act that has to do with paid leave? So there were two components. First, the FFCRA authorized the Emergency Paid Sick Leave Act, and then also temporarily expanded FMLA to cover care for minor children. So there were these two pieces that came together in this act. So care for COVID-related reasons, and also if you were unable to work because you yourself were sick due to the public health emergency. These were two things that were added, were reasons that one could take paid leave under this act. And this is nothing short of historic, right? Because the United States has not ever paid for paid family or medical leave. And so this was a very large change in direction for the federal government. And the cost was fully borne by the federal government, which is a depart from how the state family medical leave and paid sick leave programs are working in our country. So today, what I'm going to focus on is these two pieces. So first, I'm going to talk about some of the data. I'm looking at current population survey data. I'm looking at monthly data and the absences. So absences from pre-pandemic and comparing to 2020 during the pandemic. And then the second piece will be some highlights from some research that's being presented at the APAM conference at the end of March. So first, I'm going to talk about differences in leave taking pre-pandemic versus the pandemic. So here you can see a slide that's showing clearly that many Americans take paid leave in June, July, and August. So the paid leave, the paid absence is the green bar here. And you see this peaking in July, but also rising in June and in August. So we see this increase in paid leave usage in the summer, makes sense, this is vacation, but also just sort of a relative even level of paid leave in the remaining months. The blue band is unpaid leave. And we see sort of relative equal amounts of unpaid leave throughout the year. And then the top band is unemployment. And again, this is sort of relatively even across, with maybe a slight increase in January. What we saw, so this data is 2017, 18, and 19 merged. We saw striking similarity between 17, 18, and 19. So this is what we believe is a baseline pattern of leave taking in the United States. We also show that roughly 1.4% of workers took paid leave in 2019, but this average masks the seasonal variation that we're seeing right here. Okay, now we're looking at 2020. What happened in 2020 looks very different than what happened as our baseline leave taking. So first off, I want to draw your attention to the two peaks, right? So I call those the cat's ears, which sort of indicates how poor my drawing is. But there's two distinct peaks. We have first in April and then second in July. So recall that we all became aware of the pandemic in mid-March, and most states closed down in late March and April of 2020. So access to emergency paid leave became available on April 1st. Importantly, the monthly leave taking patterns in January and February of 2020 were identical to 2019. So suggesting that if not for the COVID-19 pandemic, they likely would have continued is the same as they did pre-pandemic. So I'm going to put these side by side so we can take a look at them next to each other, because it's just easier to see things next to each other. So first, employment is higher in March through December 2020 than it is pre-pandemic, right? Clearly, the gray band is much bigger. We still see the peak in paid leave in July. That green band still goes up. We also see a slight jump in paid leave in April, right? The green is a little, it's elevated in April as well. And we also see a slight increase in unpaid leave in April as well. So the next several slides will break this down by race. Okay, so when you look at these leave patterns for white workers, it pretty much mirrors what we've just been seeing. And that makes sense because the white workers comprise the largest group of workers. But when we look at African-American leave taking, we see a difference here. Clearly, the unemployed, that gray band is much bigger here. There is about the same amount of paid leave, that green, and in COVID and non-COVID time, but we do see an uptick in April here as well. What I want to draw your attention to is that the use of paid leave among African Americans is lower than it was among white workers. And the same patterns we see for Hispanic leave taking with higher unemployment, a little bit higher unpaid leave, but very low paid leave. And then for other race, we see the same thing. Here we see a slight uptick in, or a noticeable uptick in unpaid leave in April. Okay, so now that I've sort of laid this groundwork of pre and post, pre-pandemic and during pandemic, I want to focus now on the research that we're presenting. It's some high-level findings of the research that we're presenting in April. So now we're looking just at paid leave. That's our outcome. We're looking just from March to June 2020, and we're comparing eligible and ineligible workers into 2019 to assess this, whether there was a difference due to the FFCRA. Eligible workers are those who were with an employer with fewer than 500 employees, which is part of the FFCRA definition. So we're using a difference in difference modeling strategy. The pandemic here serves as this exogenous shock, right, to our system. We saw that clearly in those figures that we looked at earlier. We're looking at paid absence from work in the last week. And again, we're looking at differences in paid leave in large firms and small firms from 2019 to 2020 in March through June. Our sample is those who are aged 21 to 59. And we're using the basic monthly sample in the CPS, as well as some of the ASEC questions, because we want to look at firm size, which is asked in the ASEC. Okay, so our high-level findings. We do find that there is an increase in paid leave in April by 64%, right? And that makes sense. You saw that peak, right? There's no difference in May. There was a reduction in paid leave in June of 29%. There's equal use of paid leave for small and large firms in April. So think about it. If you, as our economy is shutting down in April, if you couldn't go to work and you had paid leave, you used it, right? And so we have this, equal use of paid leave for small and large firms in April. But we see in June, when people typically were taking vacation, right? We see this sort of switching, right? So we see higher use of paid leave in June among the small firms by 71% compared to those who are in large firms. So those who had access to emergency paid leave were able to take their June vacation as well. So we are suggesting that there's been a shifting of typical seasonal paid leave from June to April to accommodate this nationwide shutdown if you did not have access, if you were in these large firms. So workers with access to without access took this unexpected leave in 2020 in April at the expense of taking paid leave when they usually do in June. Small firm workers were able to take paid leave in April and in June. So this is suggesting that April leave was taken under the temporary FFCRA. So we're finding that access to emergency paid leave was effective at expanding access during the early onset. But what's one of the things we really want to understand is which workers were driving this effect, who was able to use FFCRA. And we find that it's men and parents of children under 12. And so we were surprised or not surprised by this not statistically significant effect for women comparing against the two firm size, right? So, and it was also not statistically significant by race. And so we were wondering why. And so this is where the context of the pandemic is really important to think about. So one is a statistical reason, right? If you slice and dice your sample, it gets smaller and then you don't have statistical significance. So that's one piece of our story. You know, we're looking at African-American women, and then we're comparing them on a monthly basis in small firms and large firms. So that's, you know, that's one piece. But the other piece that I think is more pertinent to policy is recall that minority women and women in general have lower access to paid leave, right? So that's something we've seen in the slides. When the childcare and school closures occurred in April and end of March, women exited the labor force. And if you are not in the labor force, then you are not going to be able to take paid leave because it requires that you're in the labor force. So to the extent that women and minority women are disproportionately leaving the labor force because of the gendered home and family dynamics that were discussed in the earlier session, then they're just not able to take that paid leave. So paid leave requires employment. And we also saw in the slides that minority women, Hispanic women, and African-American women have those really high levels of unemployment. So they were also not in the labor force because they were unemployed. So again, you have to be in the labor force to take the paid leave. Okay, here's my last slide. So we are seeing an effect of the FFCRA. It's a sizable effect given that given this really low rate of paid leave use. What is unclear is whether the FFCRA is addressing equity issues. First of all, it's not universally, it doesn't have a universal access, so large firms are excluded. There was also a carve out for health industries, and we know because of occupational segregation that minority women are more likely to be in these sectors. There are differential impacts of the pandemic, the unemployment spike among women of color, you're ineligible if you're not employed. These are differential impacts that we're seeing. They're gendered impacts and they're racial impacts that are they're having implications in our findings, I believe. Just 2 days ago, I got an email about the White House is pulling together a national COVID-19 preparedness plan. And in that plan, the president is requesting that there's a provision for paid sick leave to workers who need that leave. And, you know, I would call upon all of us here to ensure that this policy has equity in its bones, so to speak. So include those large firms and don't have a carve out. And then the future steps that the research team that I'm on is working on is looking at the employment outcomes of the FFCRA. So are women and minority women remaining employed, for example, or is it, you know, is the FFCRA increasing in retention? So I'm going to stop there and hand it back to you.
Thank you, Kristen. Yeah. Thank you so much. We currently do not have any questions, so we're good to go there. And if those at home watching, please feel free to go ahead and put some questions in the chat if you have any. Thank you for setting the stage and helping us understand not only the impact of paid leave during COVID, but also unpacking the FFCRA and helping us to understand exactly, how impactful and how it affects, particularly in regards to racial equity. Thank you.
Yeah.
Now I'm going to turn it over to Cassandra.
Thank you. Thank you so much for having me today. Really excited to be here and be a part of this conversation. And before I get started, I just wanted to let folks know a little bit about A Better Balance in case you're not familiar. We are a national legal and policy nonprofit organization. We have offices all around the country. I'm based in New York, and our team has been working on paid family and medical leave throughout the US at the state and federal level for over a decade now. And we also have a free legal helpline where we speak directly with workers and guide them through their workplace leave issues. Okay. And I also just wanted to get us started with a really helpful map of paid family and medical leave laws around the country. Currently, 9 states and Washington, D.C. have paid family and medical leave laws on the books. So those 9 states, in addition to D.C., are Rhode Island, New York, New Jersey, California, Massachusetts, Washington State, Connecticut, Oregon, and Colorado. And I think that this map is really helpful because it shows just how much opportunity we have to really gain more state paid family and medical leave laws. All of those grayed out states are states where workers do not have a right to paid family and medical leave. It's a lot. It also really shows how significant and impactful a federal paid family and medical leave law would be. It would help out particularly all those millions of workers in those gray states. So keeping that in mind through this conversation, I wanted to go over some key components for ensuring that paid family and medical leave laws are racially equitable. And I just want to stress before I get really into the meat of it that these are just some key components. There are many other key components to consider as important policy points when you're really thinking through how to create an effective paid family and medical leave law. But these are just some of the ones that I thought were most important to highlight for the purposes of racial equity. So the first one here is job protection. Job protection allows workers to take time off from work when they need it and know that they have a job to come back to upon returning from leave. So it's very important. Other essential employment protections that are often tied up with job protection include the protection against retaliation or interference with leave taking and the continuation of health insurance during leave where applicable. Job protection is particularly important to workers of color because we know that workers of color are less likely to use paid leave if they are not guaranteed to have their jobs when they're ready to go back to work following leave. The fear of losing their job is one of the most commonly cited reasons that workers give for not taking leave. And Black and Latinx workers in particular are more likely than white workers to report having an unmet need for leave. And that means that they needed leave, but they weren't able to take it for lack of access, being scared of losing their job, et cetera. So that's job protection. This next piece is about inclusive family definitions. So every paid family and medical leave law specifies the family members for whom workers can take leave to care for when they're seriously ill. And an inclusive family definition allows workers to care for all of their closest loved ones, regardless of legal or biological relationship. Now, this is especially important for workers of color and LGBTQ workers because they are more likely to have families that don't fit into the sort of mythical nuclear family mold that has often been enshrined in paid leave laws. And so, for example, people of color are more likely to live in multi-generational households or to live with extended family members, which necessitates this inclusive family definition. It really just honors all families and helps workers care for the ones, for their closest loved ones. This next piece is about covering all workers, including public sector workers, seasonal workers, and domestic workers. Who the law covers really just means who is included under the scope of the law's protections. The most equitable paid leave laws cover all workers. But in particular, I wanted to highlight those three groups that are listed on the slide because those are really important pieces of the workforce to cover when you're really thinking through racially equitable policies. So public sector workers are listed because Black workers are disproportionately represented in public sector employment nationwide. So ensuring that public sector workers are covered is really key here. And seasonal and domestic workers are both groups that are disproportionately comprised of immigrants, and in the case of domestic workers, women of color in particular. And seasonal and domestic workers are also historically underprotected workers. So these are all just key groups when really thinking through racially equitable paid family and medical leave policies. Now, this last point, progressive wage replacement rate, this is kind of two things bundled up into one. Here, it's really important to note that this whole time we've been talking about paid leave, which is really critical for workers of color. So there are laws that you might be familiar with, like the Federal Family and Medical Leave Act, also known as the FMLA, which provide unpaid leave. And that can be super inaccessible for workers of color because Black, Latinx, and Native American workers are less likely to be able to afford unpaid leave than our white workers. So with that pay piece in mind, the wage replacement rate is important. And that's the percentage of income that workers receive while they're taking leave. And the most equitable model there is what's called a progressive wage replacement rate. That's where lower income workers receive a higher percentage of their incomes while they're on leave. And this is especially important for racial equity because of the way that race and socioeconomic status overlap in the US. Black and Latinx workers and Black and Latinx women in particular are disproportionately represented in the low wage workforce. So ensuring that there's a progressive wage replacement rate just really helps workers access their paid leave once they have the ability to take it. So now I want to talk about some key components to ensuring equitable implementation following the successful enactment of a paid family and medical leave law. All of these components can and should be considered when you're at that legislative stage, but these come into play more so after you get a law on the books. So once you have a paid leave law enacted and on the books, it's really crucial to get the word out and engage in a robust public education effort. Workers aren't going to take leave if they don't know they have the right to do so. So really just letting them know what their rights are under the law is key. And that's also important to couple with robust enforcement, which helps hold employers accountable and really just ensures that workers can actually access their paid leave. And these are both really important pieces to keep in mind when considering racial equity because workers of color and other historically marginalized workers are often the ones that are left out. So just really important to make sure that they have access and know about their rights. This next piece is about language access. So all paid family and medical leave materials, so we're thinking like the website for the program, any telephone services that are available, application forms, they should all be really thought through to ensure that workers understand their rights, can understand what they're looking at and reading. And they should also be available in a number of languages in addition to English. And this point is especially important for immigrant workers and non-native English speakers. And then this last piece that I wanted to highlight is about thorough reporting from the administering agency. This is really important once a program is up and running, because it helps show whether a paid leave program is actually being equitably implemented. So for example, being able to look at a program's numbers and see how many Latinx workers, for example, were approved for paid leave versus how many Latinx workers actually applied for paid leave, and being able to compare that to other racial and ethnic demographics is just a really powerful way to hold a program accountable. And then in this last slide, before I pass it back to Raven, I just wanted to share my contact information. This is my email. I'm thinking through paid leave all day, every day. Please feel free to reach out to me for any questions. And also our website, abetterbalance.org, has a wealth of information about paid family and medical leave. So just wanted to boost those as we're keeping this conversation going. And I'll pass it back to Raven.
Thank you, Cassandra. What's really wonderful about this conversation is that we've started with the research. We've then kind of taken a second to understand not only does paid leave work, but it's another thing to have a policy that is equitable and that is implemented equitably. And now we're gonna talk a little bit about what it looks like to have paid leave turned into a reality on the state and local level. So we're gonna turn over to Alyssa Silverman on Zoom. It's all yours.
Great. Good afternoon to everyone, and thank you to the organizers of this great conference and panel, and good to see some familiar faces. So I'm Alyssa Silverman, and I'm a at-large council member here in the District of Columbia, which means I represent the entire city, and I was one of the co-authors of our paid leave law. So actually, as Raven just said, you've heard from the academics and researchers who presented a lot of scholarly rigor and data. So I don't have a PowerPoint. I'm going to go in a different direction and give you an on-the-ground view, peppered with some anecdotes and personal narratives. So let me start with what was previewed, that we had some absolutely stunning news this week, that DC's a private sector paid leave program is going to dramatically expand from 8 to 12 weeks for parental leave, from 6 to 12, up to 12 weeks for family caregiving leave, and from 6, which actually just happened very recently, for medical leave, up to 12 weeks now. So we're going to have 12 weeks in each, up to 12 weeks for each of the 3 categories of paid leave. But the drama didn't end there. The tax rate that employers pay to fund the program would be cut by more than half. And I really want to emphasize how this came about. It came about because of oversight. And I really have to credit my colleagues, my staff on my labor committee. I chair the council's Committee on Labor and Workforce Development, which is oversight over the paid leave program. We saw after about a year and a half of the program being in place that there was a large surplus. And what we did is we required the city's chief financial officer to do a rigorous analysis to see what level of benefits the fund could actually sustain, and to increase the benefits to a sustainability level. And then after we increase those benefits to those levels, then we would also adjust the tax rate. And I have to tell you, I thought that was going to happen over a number of years. I had no idea that it would happen in 1 year. And I just want to emphasize that just putting a law into place, that's like just the beginning. Because there's a whole implementation phase, and then of course you need to do the rigorous oversight to make sure it's working well. And I'm going to say something that I think isn't normally said at these presentations, that we want to make sure the tax dollars are spent well. and I know we have a focus on racial equity that I'll get to in a moment, but this is stunning news, I have to tell you, because given, 7 years ago when we introduced this bill in October of, I think it was 2015, it was a major fight to get this bill passed. And here's where I'll go with my little anecdotes. I remember having lunch in like early 2016 with a former council member who was seen as like the biggest progressive on the council. And he told me, paid leave's never going to happen, Alyssa. It's never going to happen. You're going down a path that's going to be fruitless. But I am going to share some on the ground observations, and I think Carol will agree with me. So, given that the panel's focused on racial equity, for those who are in the battle right now, I'll say that one of the challenges we had that in DC, the battle for paid leave was often characterized as being led by white women who wanted increased maternity leave. And that was a problem for us in terms of who was testifying and advocating. And I spent a lot of time with Carol Joyner, who you'll hear from in a moment, and other, especially Black women in this city, in an effort to reach out to Black and Latino workers to get involved in this effort. Because in the District of Columbia, there's a tremendous racial disparity in income and who's working the jobs that we just heard about, and that we know that Black and Latino workers in our city are, the predominant workers in our lower wage jobs. And also when it came to the pandemic, who were those essential workers who had to work in person, they couldn't work remotely. And so we know that for those workers, and I think that speaks to the graphs we just saw before, if you work in person, you can't, and your child has to stay home from school, that is a big challenge. And we also know that the higher wage jobs are, now paid leave is one of the big benefits that people are looking for. But even when we were discussing this bill 5-6 years ago, and it's incredible how the landscape has changed, we knew that higher wage employers were starting to offer paid leave, where lower wage jobs, it's just not part of the benefits package. I say that to say that we knew that, Black and Latino workers and other workers of color would truly benefit from a paid leave program in our city. And, I think there's a lot of academics and researchers in this crowd. So that the benefits are not only to workers, but to employers as well. And I think we've seen that in the pandemic with the Great Resignation, workplaces that are family friendly, that are flexible, that offer paid leave are more likely to retain workers because workers feel like those employers are caring for them and their needs. And there's a loyalty and a productivity to the workplaces that offer paid leave. But I will tell you that employers were not convinced of that argument for many, many, many years. And I'll give you the litany of people who are against paid leave: the Chamber of Commerce, the Regional Chamber of Commerce. Here's some surprising ones, folks. The Consortium of Universities, one of our biggest employers. So Georgetown, a Jesuit university, American University. So I have to say, unfortunately, American University, I think where you guys are sitting right now. Our Hospital Association, all of our healthcare employers fought this law. The Restaurant Association, I can almost guarantee that if you're a district resident, one of your most favorite sustainable agriculture, farm to table, progressive seeming restaurants initially testified against this bill. But, we've all come together with a big hug. Because we've had other issues with, on wages as well. But so I don't have enough, you guys don't have enough time for me to go through all the drama, but you can call me if you want me to. But in July 2020, in the middle of the pandemic, our private sector program launched. It was incredible. And it launched and it worked. And I'll just share with you a couple anecdotes. One of the mayor was not the most supportive of this program, I will say, initially. And I will tell you that one of her best friends, a Black man who owns a business in this city, came up to me after the fight. And his sister is actually a DC government worker. And we do have paid leave, which we're trying to expand for our government workers. We have 8 weeks of parental and family caregiving leave for our district employees. And he told me that his sister is a district government employee. And when their mother was in the end stages of her life, he said, having my sister's paid leave was a lifesaver. Because he said there were so many difficult decisions that we needed to make. And he owns a small business. And he told me, you know, I was so stretched and my sister was able to take the time off. And, you know, she has a family, so it was compensated time off. And she was the one who was really able to do, you know, the research and make the difficult decisions. And I didn't get into the details with him, but you know, he said the difficult decisions they needed to make and that they felt at peace with the decisions that they made. And he said that was such a difference. And he became a believer in paid leave. And I'll tell you that I actually was just talking to another small business owner in our city who told me, and I remembered he testified against paid leave, and he told me it's working. That I can't remember the exact circumstances, but one of his employees was able to use paid leave. And he said it was a lifesaver for her and it was a lifesaver for him because, you know, this is a valued employee. He's a small business and it allowed him to be able to pay for her to take that time off that she needed. Okay, so now I'll join everyone else with some actual data and get away from my cute anecdotes. So what are we seeing in terms of racial disparity in our programs? So we do see some differences in usage that we need to address. And I certainly want to emphasize the point that was made prior to me by Cassandra that, you know, we really do need to have the transparency and data and consistently be looking to see who's using the program and who isn't. So in our private sector program, we see that Black workers are consistently in need of medical leave. And I'll just give you a few data points. So Black workers were 38% of all claimants. So this is the program overall, but made up 56% of medical leave claimants. So our Black claimants workers who were looking for paid leave were looking for medical leave, a lot of medical leave. And if you know the district, you know that there's a difference in, there's a racial disparity in our geography, and that east of the Anacostia River is predominantly Black neighborhoods. And we saw that 41% of claimants from one of those wards, there are 2 wards east of the river. So from Ward 8, which is a predominantly Black ward, that 41% of Ward 8 claimants applied for medical leave, but that in the other wards that are either predominantly white or sort of more racially mixed, it was less than 25% were applying for medical leave. We also see that in our government program, as I mentioned, we have a public sector program in district government as well, that Black and lower salaried workers in our government are disproportionately the ones who need to take leave without pay to address personal medical issues. And actually, I need to thank Cassandra Gomez for testifying at a hearing we had earlier this week on this issue. We've done things that we hope will address some of the racial equity issues. And I want to thank actually the Bowser administration for partnering with us on this. We've added to our private sector program, and we hope to add to our public sector program 2 weeks of prenatal leave, because we know that that is a tremendous issue, especially for women of color, who we certainly see disparities in terms of outcomes there. And let me see, I don't want to go on too much longer. I'll just say that certainly I'm concerned about take-up rates and who is using the program. So I couldn't agree with Cassandra more. We do have a progressive wage replacement rate. So lower wage workers have 90% of their wage reimbursed, and we have a cap of $1,000 per week. So the higher wage you are, the less your wage is replaced by this program. Of course, we see a lot of private sector employers who fill in or top off, as they say, to replace the wage. But we need to do a lot more outreach. Obviously, as I said, we launched the program in July 2020 in the middle of the pandemic. So not everyone was paying attention to the new great programs that we're offering in district government. And I'm very concerned that I would say the most moving testimony, like I will still think of a worker, actually a Black woman who I believe was probably in her late 50s, who worked at the TJ Maxx right near City Hall. And she talked about how she couldn't get time off, paid time off to do her cancer treatments, and I think there wasn't a dry eye in the room after she finished testifying, and it's that woman or her colleagues that I want to make sure are taking advantage of our program. So there's a lot more work to do. There's a lot more education, as Cassandra talked about, that we need to do in terms of making sure that workers know about the program. I'll also say one more thing. We've done a little bit of analysis, as I shared with you. We also see that Black workers have a higher denial rate, which I think might have to do with the documentation that is required. Because I think one other thing that to those who are perhaps in states where you're debating or introducing or debating a paid leave law, you can't just take 12 weeks. You have to have a qualifying medical event, and you have to prove that you have a qualifying medical event. And we do see that Black workers have more difficulty in getting approval for paid leave. So that's something that is concerning that we want to look into as well. But I'll stop there because I know you have a great presenter following me. And thank you guys very much for inviting me to come.
Thank you, Alyssa, not only for your insight, but I personally love the anecdotal storytelling, the drama, as you called it. I love a good drama. Not only because it tells us a little bit about the fight, but it also is the story of how fighting for a policy and making sure that the folks that are going to be most impacted are centered in the fight. And I don't know of a better person to follow your presentation than Carol Joyner. So I'll go ahead and turn it over to Carol.
Hey, thank you, everyone. Away from my slides, excellent. And I just want to echo before I start my slides. First of all, thanks to everyone on this panel, your amazing presentations, to you, Raven, for your leadership on this panel. And, Alyssa Silverman, Councilwoman, you know, doing the work with you around DC paid family leave was exciting and powerful, and it sort of let us know, A, that we can do really big and important things for working people, and that we can also manage the drama that comes along with that. And so every step of the way where we, you know, we had opposition and we had drama and we had issues, including the pandemic, there was leadership there to help us see it through. So your team, your work, your vision, it was super, super powerful. I'm gonna reference one or two things that you have said because I just have to comment on them. And I also want to celebrate the fact that DC will now have 12 weeks across the board. I mean, one of the things when we were working to pass this bill in DC, we were very disappointed that we had this like stratified reasons for care, especially with 2 weeks for medical, for all the reasons that are around race and equity, the larger population of older people of color in DC, you know, so many reasons. And so, you know, the fact that it is expanding and growing and changing is a testament to your leadership. And so thank you. Again, I'm Carol Joyner. I am the Labor Project Director at Family Values at Work. And do I move the slides or do y'all?
We'll move them if you
Okay.
can. Just
Oh, you can go to the next slide. And I'm really, you know, I really appreciate all the research. I think that all of you have laid the ground for this conversation about how paid leave, you know, how critical it is. We found out just how critical it was for those who never really thought about it, right? In 2020, when the pandemic hit. And we also always knew that it was inequitable, that there were a group of people who had greater access to paid leave right out the bat. And even when laws were passed inside of corporations, there was a hierarchy that got access to it, and then folks on the ground doing the service work for that organization or that corporation often didn't. So we were keenly aware of that. And years ago, after California passed paid family and medical leave, thanks to the Labor Project, you know, in its original existence, and the state Fed and all of the organizing institutions that joined them, California passed paid leave. And, you know, many folks got together at that point and said, wow, we really need that in our state. We need to have that. As a result, Family Values at Work began to organize, you know, folks at a table that share funding and resources and peer learning. We are now 27 state coalitions and 33 organizations. The Labor Project merged, so now we are part of Family Values at Work, a project of Family Values at Work. And during the pandemic, because we didn't have enough going on, we also stood up a C4 that we are building out called Family Values at Work Action. So that's who we are, and all about busyness. Next slide. And so the model, you know, I'd like to say that the model was the first bullet, but it actually was the second bullet. The original model was about winning and implementing robust policies for paid leave and paid sick and safe days. And only in a few years recently have we begun to focus on childcare. Over the years, we realized because of this equity issue that that really wasn't enough, that we needed to go further. We needed to make sure that women and people of color were, you know, at the center of this conversation, that we needed to build power with those communities. And so we reached out to more multi-issue coalitions and began to really create the framework with national partners, almost everyone on this panel, quite frankly, with national partners around how to build gender and racial and economic justice within the context of care. Next slide. And so, you know, Cassandra went through where all of the paid leave wins were. I'm not going to repeat that. 10 states, including DC, covering millions of workers, expanded policies over time. So the beauty of being able to think about, does this cover everyone, means that you can actually go back in to a bill and say, well, it's not covering these folks, let's tweak. And if you have a willing, you know, city council, if you have a state legislature, right, or council in some ways, you'll be able to make those changes. So expanded policies in California, precisely because we learned that folks were not getting access and not using the policy, probably because of job protection and the way job protection was constructed and narrowly tied to FMLA, right? When in New Jersey, needing to make sure that there was a better, definition of family and that they closed some of the loopholes. And then you see this amazing expansion in DC, and almost every state that has passed a paid leave law has attempted to make it, more available to workers, more accessible to all families. And so the idea was creating the model for other states. So other states are looking at this. There are many states in play right now. Pennsylvania has a paid leave program. Maryland is super close. Delaware has a paid leave bill. West Virginia has a paid leave bill. There are so many folks who are looking at this and saying, if we can't win it on a federal level, or we may or may not win it on a federal level, we're going to keep fighting on a statewide level. So it's built the momentum for national change. It also laid the foundation for federal policy, right? So we woke up, and some of you on this panel were actually with us in 2019, where we said we wanted to do two things. We wanted to, recognize that we have built this momentum on the ground with these different policies that are passing or in the process of passing. And we want to make sure that that moves to a federal level, because that big gray area that Cassandra showed on her map, in most places, it's going to be very hard, if not impossible, to pass a paid leave policy in those states. So how do we make sure that the entire nation joins the rest of the world with some sense of paid family and paid time off? So when we had said in 2019 that our goal was going to be to pass paid leave by 2023. We thought about that for our network, but we also thought about it as we established with many other partners, Raven's group, Paid Leave for All, the national campaign. And what we learned from that is that, the Family Act, which had been a bill introduced in Congress by Rosa DeLauro and Christian Gillibrand for probably 7 or 8 years at that point, that would lay the foundation, that it had enough, provisions in it to address the critical issues, particularly the equity issues, but we also knew it had to go further than that. So when the pandemic hit and people began to look at, well, what do we need in this crisis, in this moment? We ended up with FRCPA, but we didn't start with FRCPA. We started with a national paid leave program, organizing and doing the lobbying for that in Ways and Means and with other partners. Politics being what it is, we ended up with FRCPA that left out probably about 106 million people with regard to this policy. However, it laid the ground, and for the first time, the United States had some semblance of a paid leave program. Recognize, though, that given Chris's, a research on the way in which, people of color were left out of that, we knew that was going to be, a huge problem unless there was a mandate, which this was, but it excluded so many workers, right? Build Back Better was the next, sort of like space for us to do organizing around, finally, comprehensive paid family and medical leave that gets us equity built into the provision. Next slide. And so the racial justice piece for us in terms of organizing was always about, at least when we woke up to this, maybe a decade ago, about, well, how do we really think about the way in which Black and Brown people have been caregivers for history in this nation, right? How do we reverse a devaluation of caregiving rooted in the systemic racist practices that we all know? So that was one real sort of value setting place for us. We also wanted to say it's not enough just to recognize that this was a racist system of caregiving. We don't want to continue this, thing that we had been seeing of, Black and brown people, people of color largely being talked about as needing paid leave instead of, being out front and talking about publicly the need that they have. We knew that in many of the campaigns it had passed on the ground at that point. There were lots of people of color deeply engaged, but when it came time to be spokespeople, you didn't see them. You saw white people talking about it. And so that goes to the issue that Alyssa brought up in DC, where there was this really racialized and racially politicized issue of who needs paid leave? Who is this really for, right? And they said that it was really for, people who had gentrified the city, white middle-class women who need time off to care for their new babies. It was really reduced to that, when in effect, we knew that there were many people of color across the district, but they weren't the spokespeople of these campaigns. So how do we make that happen? We also knew, and this is something that's really complicated and probably is a whole conference of itself, that people will weaponize race, in terms of, for their political gain. We know there was an opposition, and Alyssa named who the opposition was, right? So we know there was an opposition, and that opposition had the money to fund a campaign that essentially went into the Black community that said, you don't need paid leave because you need jobs. You don't have enough jobs. You should focus on that instead of paid leave. That was real. We saw how that played out when we went into Black communities, but we also heard from other people. So we have to be savvier and much more thoughtful about how race divides us in these policies. And then the last thing, of course, was, so one way to address that is prioritizing the leadership of those who are most impacted, speaking for themselves, talking, to these truth to power. The last item is, the importance of, and I think this was mentioned by Cassandra as well, recognizing all families and all family structures to ensure that Black and brown folks, and that race is considered within the context of, how families are created and the family structures that people choose. Next slide. And so one way that we began early on thinking about this was in the equity provisions. I'm not going to go through these provisions because Cassandra did already, but we believed, after looking at what happened in the state, what the take-up was in certain states and why the take-up was lower for people of color, we realized that these were the very provisions in the bills that blocked access for Black and brown people. And it made it less equitable across the board, not just for Black and brown people, but when you don't solve for them, then you also don't solve for disabled people and a whole bunch of other folks that are not already getting paid leave, right? And so we came up with this little idea of that paid leave needs a AAA rating. It needs to be accessible, meaning covering all workers. So that goes to the reasons for care. It needs to be affordable. So that goes to the progressive wage replacement that we've heard about. And then it needs to be adequate, a sufficient enough time for bonding or healing. And that, that's like the key point in DC getting 12 weeks for medical, right? Next slide. And so the leadership of those most impacted became our rallying cry a few years ago, and just saying it's not, we have to figure out, this is not okay. It's not okay for your website to just have some Black people or some brown people on it. It's got to be the voices of people. People have to be in the conversation of what the policy looks like. And so we began organizing deeply within the Family Values Network in terms of looking at advocacy groups, organizing groups, civic engagement, and other groups. So not just policy shops, not that there's anything wrong with policy shops, we love them. They do like the heavy lift of a piece of this work, but we also know that there were folks on the ground that we needed to build capacity there. We also worked closely with Paid Leave for All to create a Voices of Workers group when we built the campaign, because we for years been identifying workers to speak out more and to be engaged and to center this piece of their work. But we we aimed to establish a formal group of folks who were already leaders in their own right, who were already multi-issue folks doing work on education, in healthcare, in disability rights, and ask them, like, could you weigh in a little bit more on leave? Could you join this campaign? I think I lost the slide. I'm sorry. I think I lost, there you go, thank you. And so, so the Workers of Voices group was created, and as a result of that group, during the passage of Build Back Better, there were countless ads, social media, they've testified in front of Congress. They've become real leaders in their own right inside of their states. And it just really created a space for us where people of color and other folks were speaking out about these issues, and we were hearing directly from them. They coined the term that, our stories are data. That's the data that Congress needs to hear. And we kind of went with that. We also worked with the Hill that had a practice of, if we're going to do a hearing, we only want to hear from the experts, right? That was a thing, when we first started this campaign, and we worked with them on, well, these are the folks who really are experts. They're experts in what it means not to have paid leave. They're experts in what it means to be a person who is working a lower wage job and having to care for their sick family member. These are the stories that and members of Congress really responded to that, right? And then we did a huge emphasis, particularly when FRCPA came out, on creating a toolkit on our website for Know Your Rights. We worked with many of our national partners and combined that with unemployment insurance, because what we haven't said is that paid leave and unemployment insurance during the 2020 part of the pandemic were like two sides of the same coin, right? Yeah, next slide. And so the last thing, and I have no idea why this slide looks like this and what happened in the translation, but the last thing I would say is that, under Wendy Chun-Hoon's leadership, when she was at Family Values at Work, even early on, we began to really talk about, like, what does it mean to recognize all families? And I see ABB is on the panel, so it's really important to note that we created with them the Family Justice Network, which is a group of organizations that really try to, at least for a couple of years, think about what does family definition mean? How do we get that into the ether to make sure that when policies are passed, all families are covered? And so that, I think, helped to, one, with ABB's legal work, we were able to get that into as a standard language in a lot of the policies, but also how do you then socialize that on the ground and make sure that folks are testifying to that and that they're showing up and speaking and lobbying with their state legislators about that. And ultimately, we saw a huge improvement in just thinking about, a broader definition of family. I think that's the formal definition. Cassandra will, the standard language and policies, Cassandra will correct me if I'm wrong. We also worked with them on This Is My Family campaign, and we can send a toolkit out to folks, but it's essentially a campaign that allows folks to use these Canvas slides, beautiful Canvas slides, in order to show and illustrate the importance of thinking about their family. Like, this is my family. This is what it looks like. We're not the nuclear family of yesterday, and folks can really define family in the way that they want using this toolkit. And then, as I said before, we were able to get standard language for a broader definition of family in state paid family leave programs, like policies like Connecticut, Colorado, New Jersey, Oregon, and Washington. I think this is the last slide. But what I'll stop with is that all of this together, like the research and then how it gets articulated in policy, as the councilwoman talked about, and then how it gets, organized on the ground is all part of the story, right? It's the story that allows us to move from just California, not that it wasn't great, it was amazing having a paid leave program, to 10 policies around the country, and then actually having a federal bill that has almost all of the provisions that were named. It has progressive wage replacement. It has a broad family definition. It addresses legacy states, the states that have already passed paid leave, and gives them an option to sign on to the bill and to actually manage the bill. And it has universality, covering all workers, excluding almost no one. What we didn't get in it was job protection, which is huge. However, that's for another time, as is the passage of the bill. But never before in my life, I just want to say publicly, have I seen sort of so much momentum around an impactful issue like paid leave, and the drive for so many to make sure that, you know, unlike the New Deal, that this policy is equitable to all people. I'll stop there.
Thank you, Carol. I don't know if you can hear it, but there are applauses for you.
Oh, that's really sweet. Thank you.
Thank you for laying out the federal fight. And it's, I say this to you often, but it's an honor to work beside you. We're gonna now turn over to a couple of questions, and to the panelists. I'm gonna change the order a little bit because we're running short on time, so bear with me. But first I'm going to, so I'll go ahead and read the question and also direct it to a panelist, and then ask for the rest of the panelists to go ahead and jump in if you'd like. The first question is for Kristen, focusing on research. And the question is, you know, what role has research played and what role could it play in pushing forward the policy agenda for paid leave?
Thank you for that question. I think research plays a critical role, not just because I'm a researcher, but I think it really actually does. Not only in just laying the groundwork for what is usage and what are, you know, where are the needs, but also we've heard on this panel that, you know, there's a need for tracking once programs are in place, and that I would say is also research. You know, the Build Back Better plan, all of those provisions have been researched. A huge amount of research has gone into understanding why job protection is important, why wage replacement is important, why family, you know, inclusive families, that definition is important. So I would say that this effort is very evidence-based, and that's what makes it so powerful, and that there's been a response from the research community to address all of these issues as they come up.
Thank you. Any of the panelists want to jump in? We're actually going to keep, you know, the same vein, going from research to state and local policy to legislation to advocacy, like we've done through this entire event. And the next question is for first Council Member Silverman and then Cassandra, if you want to add in. How can state and local policy when for paid family and medical leave inform the national conversation? And what takeaways from your own efforts would you like to share with those in the fight elsewhere?
I think there's a lot of evidence that paid leave works, and the state level programs prove that. It works for, you know, in the anecdotes I shared with you earlier, I mean, those were two employers who said paid leave is working. It's working for me as an employer to retain my great, or, you know, to make decisions. We have a lot of small business people, as I shared, the mayor's friend, I think he owns a small PR firm. So, you know, I think he employs, you know, certainly less than 50 people, and I think less than 20, which would be the job protection standard for the district's FMLA. But, you know, it especially in light of what we've seen with the pandemic, you know, it helps retain workers. It built it, you know, what is shown in the research, and all of our great researchers, and certainly research undergirds everything we do, is borne out in reality. People are able to make the decisions and take the time that they need and not have to choose between a paycheck and caregiving for themselves or family members. And that makes it makes them more productive when they are back at work. It makes them happy to be at work. Those are, it's shown in the research, but I think, the narrative, the reason why I did share some personal anecdotes and narratives is that I think that's what's persuasive to lawmakers. This Congress, I don't know what's persuasive to this Congress. That's why I like working at the local level, but I think the state programs work. I can't remember, it might've been Carol who mentioned that, what we saw in the California program was that there was a low take-up rate for lower wage workers. Just, it wasn't worth it for them. So we made those adjustments, but California program works. New Jersey's program works. DC's program works. And I think it should show to our federal legislators that we need, we are so out of step with the rest of the world. And we're now out of step with, I'd say if you added up those states, there's a fair amount of people. California alone is a lot of people. And, we need this for the rest of our country.
Yeah, and I'll just add, like Councilmember Silverman said, the states with these policies have really seen the benefits of paid family and medical leave policies, especially through the pandemic. And quite frankly, whether a worker has access to paid family and medical leave really shouldn't be dictated by where that worker just so happens to work. So, in one of the richest countries in the world, there's really no reason why paid family and medical leave shouldn't be accessible for everyone.
Thank you, both Councilmember Silverman and Cassandra. I'm going to kind of actually piggyback on the end of your answer, Cassandra, and talk a little bit about employers. And Carol, I know this was the question that you didn't want me to ask you first, but I am going to because I loved your answer. We were briefing. And that is, what is the role, and is there a role of employers in increasing access to paid family leave? And what progress has there been?
I think the role for employers, I'm going to rephrase my comment from yesterday or whenever we talked about this, Raven. I think the role for employers is to talk to other employers in the 10 states that have passed paid family and medical leave, including DC, which I'm including as a state because actually we should be one. But to talk to them, because what they will hear from them is that paid leave helps to retain workers. Paid leave is a humane and important policy in order to ensure that their workers and their families are okay. It's an investment in not just their personal company, but the bigger picture, right? The entire society. When the number is still, and the researchers will correct me, 21% of private sector employers, provide some form of paid leave, right? Provide paid leave. With that, I feel like they've had enough time to do it on their own. This is the other part of the answer, right? And that the employers across the country need to recognize that it's easier to participate in a national program than to try to go it alone, because they haven't so far, for the most part, like 80% have not. So I think their role is, if they're not on board yet, to fight for public policy for paid leave, to make sure that employers, can use it. Small employers lobby for it all of the time. It's the large employers that kind of sit on the sidelines. And they're, of course, their lobby and legal teams. We just need to keep, asking employers to think of the bigger picture, to think of the ordinary citizen who doesn't have access to paid leave, and contribute with their voices and their resources, and stop resisting.
Absolutely. Thank you, Carol. Just want to take a second for any of the panelists if they want to add in here. But we'll go, if not, we'll go to our last question, which is ultimately, and I'll let any of our panelists answer this one, but really just what makes this topic of paid family leave such an integral part of the care and work family conversation? And why should we, why should people really continue to care and fight for this? Why does it remain to be such a crucial part of our care infrastructure?
I'll start by calling back, Raven, to what you said at the beginning of the presentation, which are the reasons for which workers can take paid family and medical leave. So to care for themselves when they're seriously ill, to care for their family members who are seriously ill, to bond with children. These are just life moments that are pretty universal. More likely than not, most workers will encounter one or another at some point in their life. It's really just an inevitability. So having access to paid family and medical leave during those moments just eases those life moments. It allows a worker to breathe a little easier, knowing that they're not going to lose out on 100% of their paycheck. They're not going to forego their job, and they're also still able to live their lives.
Absolutely. As we say a lot at Paid Leave for All, that paid leave is what allows folks to not have to choose between their life and their livelihood. And we do have one more question from an attendee, so I'll go ahead and read that out for everyone. And it says, I'm curious the panelists' thoughts on the potential of making paid leave a portable benefit, especially for those low-wage workers who experience employment churnings. Any thoughts on that?
I mean, this is Carol. I always thought that paid leave, as it was introduced in the Family Act and in Build Back Better, and in almost every policy, is a portable benefit. It follows the worker in almost every case, right? If it's a social insurance fund, and there might be some rules that in some states that minimize the potential of this, but if it's a social insurance fund, it seems to me that you're paying into that social insurance fund, and it doesn't matter so long as your employer group is included. It doesn't really matter so much where you work. In DC, it's complicated, right, by the fact that you have to work in the district, whether you live or work in the district, live in the district or not. But if you change jobs, it does follow you so long as you're still employed in the district in a private sector company. Is that right?
Well, we're actually going to have this battle about portability because I believe we wrote the law that it was portable, but the agents, our labor agency that implemented the law interpreted it differently, and that it wasn't portable. And so I've introduced a bill to clarify that it would be. But I agree with your points, Carol, which is it's an earned benefit. It's an accrued benefit in that in the district, because we're not a state, we have a purely employer employer contribution system, whereas I think some of our fellow states have a shared employer-employee contribution into the paid leave fund. But the point being that, in the district, your employer is paying in for hours that you've worked. And I think the people who lose out the most are those who don't have job protection, and where a small business might have to say, I just can't afford to not have you here. And what I've heard from some of our small business owners is they agree it should be portable. Like, I paid in for Alyssa, Alyssa's making the decision to take leave. I can't afford to have that position not filled, but I want to give her the leave that she's accrued so that, she can take care of what she needs to and then find another job. So I do think it should be portable because it's an accrued benefit.
Thank you, Alyssa. Thank you, Carol, for tackling that last question for us. We are out of time.
There's a question.
Oh, there's one more question.
Do you have a question?
Sorry.
Please, go ahead.
I just have one question because I don't know each of the state policy on paid leave. But any of them discuss stability during this period, like meaning you cannot be fired from your work during this, during the paid leave? A lot of countries do have this, and I don't know if the policies in the US also have this requirement.
Yeah, so I think that's like, it sounds like we're talking a little bit about the job protection piece of it. And so, yeah, many states do have job protections. Some states sort of rely on the federal Family and Medical Leave Act or their state Family and Medical Leave Act to fill in those gaps. But yeah, it is a critical piece to any paid leave law to make sure that workers are able to come back to their jobs following leave and count on their jobs being there.
Wonderful. I'll take a second. Any additional questions? Thank you all so much for coming out. Thank you to our incredible panelists, Kristen, Cassandra, Councilman Silverman, and Carol. Thank you so much for all of your incredible insights, for taking the time to delve in to the importance of racial equity in a comprehensive paid leave policy. So thank you to IWPR, Care Network, and American University for having us, and we hope you all have a wonderful rest of your Friday. Thank you so much. Thank you.